Welcome to Conversations Live. For more than a decade, we've brought you the best in books, entertainment, celebrity interviews, and current events. When the movers and shakers of the world have something to say to you, they say it to us first. Now celebrating 17 years of broadcasting success, here's your host, Cyrus Webb.
And welcome back, everyone, to Conversations Live. I'm your host, Cyrus Webb. Glad you all could join us once again, both for our radio audience here in the South and our online audience tuning in through iHeartRadio. We're glad you all could be with us as well. Well, you have only to turn on the news to be able to see that the healthcare industry is definitely dealing with a lot in 2020. One of the big things, of course, has been COVID-19 and being able to chart a path forward there. But there's also another health epidemic that's taking place, and that's dealing with heart failure. It's interesting to find out that more than 6 million Americans are already impacted by this condition, and it can be fatal if it's not treated. There was a recent study called Heart Matters, a nationwide study of practicing healthcare providers that revealed widespread concern about the pandemic's effect on patients already living with heart failure, as well as new cases that can emerge in the days, weeks, and months ahead. Here to talk to us about it, we're excited to welcome Dr. Phillip Adamson to our program. Dr. Adamson, thank you so much for the time today. Really appreciate it.
Thank you, Cyrus. Thanks for having me.
Well, glad to do it. So I mentioned, of course, heart failure being one of the things that is now something that many in the healthcare industry are worried about. Tell us, if you don't mind, Dr. Adamson, as we get started here, what is the difference between heart failure and a heart attack?
Well, Cyrus, a heart attack is an acute problem that typically occurs as a result of blockages in an artery that goes to the muscle to the heart itself. And that produces symptoms of chest pain and shortness of breath. And typically people recognize that, call an ambulance, and go to the emergency department. Heart failure, on the other hand, is a chronic disease. It's one that may result from multiple heart attacks that weaken the heart muscle itself. But it's a syndrome that the heart is really unable to provide circulation to the body to meet the activities of daily living. So, for example, if a patient with heart failure goes to the mailbox to get the mail and tries to walk back, sometimes they have to stop and catch their breath, just simply walking to the mailbox and back. And so that limitation is as a result of the heart unable to move the blood appropriately for the needs of the body.
We've been hearing a lot about, when it comes to those that have been adversely impacted with COVID-19, Dr. Adamson, that a lot of times those with a pre-existing condition or may have other immune issues are definitely more susceptible. Have you found that when it comes to those dealing with heart failure that they are impacted differently when it comes to COVID-19 as well?
They are. And Cyrus, it's interesting because there's two components to that. One is a fear factor. Patients who have heart failure know that they're at higher risk for developing severe COVID disease, and they avoid health care. They avoid going to the emergency room when they need to, or going to the doctor out of fear of contacting the virus. And we've seen, unfortunately, a spike in at-home deaths as a result of that avoidance behavior. But when patients do get the coronavirus and COVID-19, patients with heart failure at much higher risk for development of the severe to critical disease process that we hear about, that puts people in the hospital on ventilators and other problems that lead to death. So it is a two-edged sword for them, both from an avoidance perspective as well as from a disease perspective as well.
I mentioned earlier that we're going to get into the Heart Matters study, Dr. Adamson, but I want to ask you about symptoms, and also, of course, people that may wonder, okay, is this something that I'm dealing with? How would they know if they are someone who is dealing with heart failure or has an issue when it comes to their heart?
Typically, people with heart failure develop shortness of breath that they notice. Many times people, as they get older, feel they are not able to do the things they used to be able to do, and that's kind of a natural aging process. But when they can't get their breath when they walk up a flight of stairs, or sometimes even when patients are sitting at rest, they develop shortness of breath, kind of a drowning sensation. That can be quite scary. So the most common complaint that people come with to the doctor when they find out they have heart failure is shortness of breath and exercise intolerance.
Well, I know I cared for my grandmother, and she was diagnosed with congestive heart failure. So it's definitely one of those things that our family became more aware of when it comes to issues of the heart. I mentioned that the Heart Matters study, Dr. Adamson. What were some of the findings there that you'd like to share with our audience that was found when it came to these in the healthcare profession?
I think the interesting thing was that the cardiologists that we serve, or that were surveyed in the Heart Matters study, felt blindsided by this pandemic, and certainly we all did, of course. Who could have anticipated this? But particularly when physicians and cardiologists specifically had to jump into the virtual medicine world, they had to do it very quickly and shift from seeing patients in a traditional medical delivery model to a virtual medical delivery model, and all the limitations of being able to see a patient through a Skype call, for example, not being able to do a physical examination, to listen to their lungs and heart with a stethoscope. Simple things like that were taken away. So they felt somewhat blindsided by this, and were concerned that patients with heart failure, in particular, were not receiving the kind and level of care that they needed to maintain their stability. Additionally, the majority of the respondents were concerned that we really haven't seen the full extent of the COVID-19 pandemic, because we don't have long-term outcomes, and it's hard to even imagine that we've been in this COVID-19 era for less than a year. It seems like years, right, honestly, but it's really been less than a year, and so we don't know the long-term effects on the heart. And many of our respondents felt that there would be a spike in the diagnosis of heart failure that would even add to this pandemic of heart failure that we see that's independent from COVID-19 pandemic.
Right. And that was an interesting thing for me when I was prepping for this. So not only are you dealing with those who are already living with heart failure, but also those who might actually have to start dealing with or are dealing with heart failure as well. I should mention to our audience that you are the Chief Medical Director for Abbott's Heart Failure. Talk to us about what Abbott is doing to prepare for the increase in heart failure, Dr. Adamson.
Well, we're really focusing on the patient and their outcomes, and we're making our existing products smaller and easier to use and easier to implant, easier to wear. We're trying to provide more options of precision medicine that can be done remotely, in particular being able to develop sensor-based technologies that can be implanted inside the body permanently in a very safe implantation process that can provide information remotely from the patient's home to the physician, and that then leads to sort of an intelligent virtual medicine model that we believe will be the future, because most of the respondents that we saw in this study felt that the virtual medicine model would not go away if the pandemic subsided, that this is a new way for us to affect medical care that's not been adopted in the past, but will be a major component of how we see our doctors and how doctors see patients over time. So to be able to bring intelligent medicine, intelligent information for a virtual visit is our goal.
Wow. And again, with everyone who's dealing with the pandemic right now, to know that if they already are dealing with heart failure or at risk, I mean, knowing that is an option definitely is important. Again, everyone, Dr. Phillip Adamson is our guest for this segment. Dr. Adamson, where can our audience go to find out more information?
Well, there's a website, Abbott.com/Heart Matters. Heart Matters is all one word, and that gives the results of the survey and other links that will help people understand the options they have from a medical device perspective in the management of their heart failure syndrome.
And one of the things I noticed that's covered there, too, is the remote monitoring as well. So definitely want to invite our audience to go there, again, to Abbotts.com/Heart Matters, and we'll make sure that we link that up for our online audience. Dr. Adamson, thank you so much for the time today. I really appreciate you stopping by the program, and looking forward to having you back on the show again.
My pleasure, Cyrus. Thanks for having me.
Hey, glad to do it. And we thank your audience for tuning in to another great segment of Conversations Live. Until next time, I'm your host, Cyrus Webb, saying, as always, enjoy your day, enjoy your life, enjoy your world. Thank you all for choosing Conversations Live today. Let's make today amazing. Take care.